My name is Brittany Irvs. I did my task on cloud computing and healthcare environment. Healthcare has been thriving with cloud adoption. When compared to other industries, healthcare organizations have more than 50% of infrastructure in the cloud, according to West Monroe Partners report that I had read online. And this is essentially believed to be because of electronic medical records, EMR, mandate. Cloud computing and healthcare describe the practice of implementing remote servers access via the internet to storage, manage and process healthcare related data. This is in contrast to establishing an on-site center where servers and hosting the data on a personal computer. So back to the previous slide when I talked about the electronic medical records mandate. Basically, the electronic medical record mandate states that the federal mandate for electronic medical records, which took effect on January 1st, 2014, was signed into law as part of the American Recovery and Investment Act. The mandate requires hospitals and healthcare facilities to demonstrate meaningful use of electronic medical records for storing information about patient interactions. So basically, the traditional way that clinics and hospitals do things was pen and paper. You write it all down, you store it in a folder, or you take the information, you gather it to paper, and you will upload it within a patient's profile on a computer, but that computer was on site. That computer probably didn't have the proper software needed. Probably search the name, click up a folder, and that's how it's done. But when this mandate came along, requirements got stricter. So therefore, you see most of these facilities leaving that way of doing things, traditional way, and moving to a more digitalized way of doing things that's in the cloud that requires more knowledge of software, hardware, how the hardware works, and what information is needed. So I'm going to talk about the pros and the cons of this. And it's going to kind of play it out of what kind of hardship that the healthcare industry is having with cloud computing, transitioning over to cloud computing. So first I'm going to bring up the benefits of it. You have lower costs by no upfront fees. So one of the biggest thing about cloud computing that computing over general that they had issues with was once you put together a network or a system, you need to have the proper or the enough resources and hardware to support the software. And so therefore, this thing, if you transition over to a newer software, you have to upgrade all that as a whole. So that costs a lot of money versus you computing using cloud computing, and you're actually just that vendor of that company provider that you're working with. You just call them on the phone and say, hey, I think I'm going to need more resources. Can you add this to my profile? And then instantly it can be added. Okay, cloud storage makes it easier for doctors and patients to collaborate by viewing medical records online. So one of the hardships, especially with the pandemic and everything else, you have to wait on hold. You have to wait to speak to a doctor or wait till the nurse gather those files for the doctor so the doctor can see it. So they'll be able to speak to you. With cloud computing, everything is uploaded to a virtual portal. They call it a portal. And you're able to discuss the results, any updates that you uploaded to the cloud with your doctor or any results that the doctor put there. And it's easily to communicate back and forth. For instance, my sister is a diabetic, type 1 diabetic, and we upload her readings from her device that's on her arm up to the cloud so that the doctor can have access to it. And it's very easy because the doctor write notes, we write notes, and it's just a better way of communicating. More secure surrounding the documents, less chance of easily lost stolen records due to natural disaster. So anything can happen. So having those documents there in a more secure place is a better look, and it actually helps in my next pinpoint to talk about the HIPAA compliance cloud storage services. This cloud service has helped to ensure providers can access data while protecting sensitive information. So this having that extra layer of security within the cloud by that provider also helps you fall in compliance with the HIPAA as far as not letting that sensitive information display all over the place. And that was one issue that a lot of healthcare providers have and had, is that information is just out there versus, on paper form versus being in a centralized location on the cloud where it is secure, more secure and less chance of losing the information. I'm gonna continue. So you have, I talked about it earlier, easier upgrades, reduce scaling costs and fees. This means if you upgrading or you downgrading, you can do that easier versus you're trying to manually adjust your system to your workload and to your environment level. All right, and then helping to expand data integration within healthcare, as we see more mobile health apps that can be used to communicate with doctors and patients, wearable devices helping to keep at-home data doctors need for visits, rapid transfer of data after scans and testing. So basically what I was talking about earlier, when I use that, my sister case as a scenario, it's easier to communicate, easier to access that information. Before cloud computing, we had an issue where you have to call this doctor and that doctor just to get your documents faxed over to the current doctor you're trying to get to. And that could take a lot of time, a lot of patience, and it's just nerve-wracking where you could just transfer these files from the portal to different doctors, especially at the children's hospital. This is used a lot because my sister might have seen like 4 or 5 doctors within that large facility. They're able to go to the portal, pull a record, look at it all at once instead of having to call a doctor here. Can you send her records, please, to this department? It's less stress for everyone. So some of the disadvantage of cloud computing. So you have a gap between those older doctors who are not familiar with high-tech performance of these systems that are being made, worry about data exposure or potential threats, and this goes into HIPAA. And so that is always, I was reading that the CIO worry, that document is saying that a lot of heartaches comes from making sure you're in compliance with keeping information safe, especially being that it's fact that it's in the cloud. Risk of uncontrollable outages and will affect the performance. You have a third party that is in control of making sure your system or the portal is working for your facility. If that system go down, you don't have the on-site ability to troubleshoot. You have to rely on that vendor to get the system up and running in a timely manner. Limited control over data infrastructure as it is managed and monitored by a service provider. As I said, same thing. You can't go in there and make customizations. You can't go and make the system run how you want it to run. You're giving a delivery package. It's hosted in the cloud. You have to take it for what it is and make adjustments to what you're giving. And you also have the thing about hackers. You have hackers out there trying to find the weakest link within those systems through the sports data. And it just might be for personal gain or just might be for fun. Hackers out there have to worry about user errors. Not everyone knows how to use the system properly. Not everyone is adjusted to using certain software, acclimated with it, especially the older generation, which now, since we are going more digitalized, we see the older generation are starting to move out, and we see newer faces, newer doctors. So summary is that the traditional way of doing things is leaving out, which is the paper, pen, filing. We see more of electronic medical records coming on site. The advantages are lower costs and infrastructure, is that more resources can be requested with less headache, ease of scalability, more flexible during those times of change, which is if you have to increase or decrease, it's more flexible. Security is more secure having your files behind a firewall versus you having your files behind a file cabinet. and it keeps you in compliance with HIPAA. And lastly, the biggest kind of disadvantage is making sure the system is secure enough so that you don't have any breaches, ransom attacks that could take place. And this is like when I was reading the article, this is most of the organization with their healthcare business concern is those people who are acting just to gain monetary or just to trying to better their skills into hacking something as large as a healthcare facility with very sensitive information. And that concludes my short explanation of cloud computing and healthcare. And thank you for your time. Thank you.